Good afternoon, I'm Liza, a caregiving student of SAS and QC. I will perform a pattern demonstration on how to insert Nasal gastric tube. The nasogastric tube method of introducing a tube through nose into stomach. The purpose for this is to feed client with fluids when oral intake is not possible, to dilute and remove consumed poison, to instill ice-cold solution, to control gastric bleeding, to prevent stress on operated site by decompressing stomach secretions and gas, to relieve vomiting and distension. Equipments required for NGT are the nasogastric tube, syringe, lubricant, cotton balls, kidney tray, adhesive tape, stethoscope, clamp, marker pen, steel tray, disposable gloves if available. Procedure for these are: check the doctor's order for insertion of nasal gastric tube. This clarifies procedures and type of equipment required. Explain the procedure to the client. Explanation facilitates client cooperation. Gather all the equipments, organization procedures, accurate skill performance. Assess client's abdomen. Assessments determines presence of bowel sounds and amount of abdominal distensions. Good afternoon, ma'am. I'm Liza. I will do a NGP for you, ma'am. Is it okay with you? Perform hand hygiene. Wear disposable gloves if available. Hand hygiene deters the spread of microorganisms but is sterile. Technique is not exceeded because the digestive tract is not sterile. Gloves protect from the exposure to blood of body fluids. Assist the client to high follower position or 45 degrees if unavailable to maintain upright position. Upright position is more natural for swallowing and protects against aspiration if the client should vomit. Checking the nostrils. Check the nostrils for pathway by asking the client to occlude one nostrils and breathe normally through the other. Clean the nares by using cotton balls. Select the nostril through which air passes more easily. Tube passes more easily through the nostril with the largest opening. Measure the distance to insert the tube by placing. Place the tip of the tube of client's nostril extending the tip of earlobe. Extend it to the tip of sigmoid process. Mark tube with a marker with a pen or Lubricant the tip of the tube at least 2 inches. Lubricant reduce friction and facilitate passage of the tube into the stomach. Silicone jelly may not be recommended to use as a lubricant due to the risk of silopencia. Water-soluble lubricant will not cause pneumonia if tube accidentally enters the lungs. Inserting the tube. Insert the tube into the nostril by directing the tube downward and backward. Following the normal contour of the nasal passage while inserting the tube, reduce irritation of the likelihood of mucosal injury. The client may gag when the tube reaches the pharynx. The gag reflex is stimulated by the tube. Instruct the client to touch his chin, to touch her chin to her chest. Ma'am, may you please touch your chin to your chest. Encourage her to swallow even if no fluids are permitted. Swallowing helps advance the tube, causes the epiglottis to cover the opening of the trachea and helps to eliminate gagging and coughing. Advance the tube in a downward backward direction when the client swallows. Stop when the client breathes. If gagging and coughing persist, check the placement of tube with a tough depressor and flashlight if necessary. Excessive coughing and gagging may occur if the tube has curved in the back of throat. Keep advancing the tube until the marking of the tape marking is reached. Do not use force to rotate the tube if it meets resistance. Forcing the tube may injure mucous membrane. Discontinue the procedure and remove the tube are signs of distress, such as gasping, coughing, cyanosis, and the inability to speak or hum. The tube is not the esophagus if the client shows signs of distress and is unable to speak or hum. While keeping one hand on the tube, verify the tube's placement in the stomach. Aspiration of a small amount of stomach contents. Attach the syringe to the end. Of the tube and aspirate small amount of stomach contents. Visual or aspirated contents, checking for color and consistency. The tube is in the stomach if its contents can be aspirated. Auscultation. Inject a small amount of air, 10 to 15 ml, into the nasogastric tube while listen with stethoscope. Approximately 3 inches, about 8 cm below the sternum. Obtain radiograph of placement of tube as ordered by the doctor. If the tube is in the stomach, you will be able to hear the air enter, a whooshing sound. If the tube is in the esophagus, injecting the air will be difficult or impossible. In addition, injection of air often causes the client to belch immediately. If the tube is in the larynx, the client usually is unable to speak. Secure the tube with tape to the nose clients. Nursing alert. Be careful not to pull the constant pressure of the tube against the skin and tube too tightly against the nose. Clamp the end of nasal gastric tube. While you bend the tube by your fingers not to open. Bending tube prevents the inducing of secretion. Put off and dispose the gloves. Perform hand hygiene. Replace and properly dispose of equipment to prevent the spread of infection. To prepare for the next procedure. Record the date and time, the size of the nasal gastric tube, the amount and color of drainage, and relevant client's reaction. Sign the charge. Documentation provides coordination of care. Report to the senior staff to provide continuity of care. That's the return demonstration that I use for nasal gastric tube. Thank you.